Hi, welcome to the lecture on solutions. In this lecture, we will be looking at the pharmaceutical applications of solutions, advantages and disadvantages of solutions, formulation of aqueous solutions as well as non-aqueous solutions, and additives that are used in the manufacture of solutions. Many dosage forms are actually solutions. There are oral solutions such as syrups and elixirs, parenteral solutions which are injectables, topical solutions to be applied on the skin, douches or enemas which are inserted into the vagina or rectum, and drops such as eye, ear or nasal drops. First, let's look at the definition of solutions. A solution is a homogeneous mixture consisting of two or more substances. A homogeneous mixture is a type of mixture with a uniform composition. This means that the substances cannot be distinguished easily from one another. An example will be salt water. When you look at salt water closely, you can't see the salt particles anymore. Therefore, this is a homogeneous mixture. Can you think of some advantages or disadvantages of formulating drugs as solutions? Some advantages of solutions are it has a rapid action. Solutions generally work quickly because the drug is already dissolved. The dosing is flexible because it is easy to measure out different doses. It can easily be swallowed by children or by patients with swallowing difficulties, and it is easy to manufacture. However, there are disadvantages to solutions too. Drugs may be chemically unstable in solutions because they are continually exposed to water. Many drugs are not water-soluble, so it's challenging to formulate them as solutions. Solutions are also bulky, which makes them inconvenient to store and transport. The taste of a drug, which is usually unpleasant, is more pronounced when in solution as compared to a solid form. If a drug product needs to be formulated as a solution, water is usually the solvent of choice for obvious reasons. Water is non-toxic, compatible with the body, and can dissolve a wide range of materials. Pharmaceutical water falls under several grades based on their application. Here are two examples. Purified water is actually drinking water which has been purified by deionization, distillation, ion exchange, reverse osmosis, filtration, or other suitable purification procedures. Purified water is used to produce non-parenteral preparations and to clean certain equipment. Water for injections is used when bacterial toxins must not be present, for example in parenteral solutions. If you see BP and USP, BP stands for British Pharmacopoeia, whereas USP stands for United States Pharmacopoeia. These are monographs that specify the quality required for pharmaceutical products. Therefore, these waters must meet the quality that is stated in the BP or in the USP. Although the preferred solvent for drug formulation is water, not many drugs are soluble in water. We'll look at the approaches to improve aqueous solubility, namely co-solvency, pH control, solubilization, complexation, chemical modification, and particle size control. With co-solvency, a water-miscible liquid that can dissolve the drug can be added to the water to improve drug solubility. Some examples of co-solvents are ethanol, sorbitol, propylene glycol, and glycerol, or also called glycerin. Importantly, the co-solvent must be non-toxic and non-irritant. For example, cotrimoxazole is an antibiotic which is poorly soluble in water, so the addition of another solvent, propylene glycol, helps to improve its solubility. Another example is paracetamol, which we often take for pain and fever. Since it's not very soluble in water, the addition of alcohol and propylene glycol helps to improve its solubility. Changing the pH of the solution is another common technique for increasing drug solubility. The solubility of a weakly acidic or weakly basic drug is influenced by pH. If the drug is a weak base, its solubility can be increased by lowering the pH, which is making the solution more acidic. On the other hand, if the drug is a weak acid, its solubility can be increased by raising the pH, which is making the solution more alkaline. However, although changes in pH can increase drug solubility, some other factors must also be taken into account. pH can also influence the chemical stability of the drug, dyes, preservatives and flavors, bioavailability of the drugs, and activity of preservatives. With parenterals and ophthalmic solutions, meaning injections and eye drops, extremely acidic or alkaline pH should be avoided as they can cause pain and irritation. The pH of a product is therefore a compromise between drug solubility, stability and bioavailability, function of excipients, and the acceptability to the patient. The third approach to improve aqueous solubility of a drug is through solubilization, which is by adding a surface active agent or called surfactant. Soap is an example of a surfactant. A surfactant molecule has a hydrophilic head, which is soluble in water, and a lipophilic tail, which is soluble in oils. Let's say we have an oily drug. Oil and water don't mix, but when a surfactant is added, they form structures known as micelles, where the lipophilic tails are immersed in the oil and the hydrophilic heads are immersed in the surrounding water. Ideally, a surfactant used to improve aqueous solubility of a drug should have a HLB value more than 15. HLB stands for hydrophilic lipophilic balance, which indicates the relative balance in size between the hydrophilic head compared to the lipophilic tail. Higher HLB surfactants are more water soluble. Obviously, the surfactant should also be non-toxic and non-irritant. It should mix well with the solvents in the formulation and be compatible with other ingredients. It should not have any unpleasant taste or smell, and it should not evaporate easily from the product. Surfactants should not be added in excessive amounts as this could increase the cost, cause toxic side effects, produce bubbles which causes air to get into the product during manufacture, and reduce bioavailability of the drug if the drug is too tightly held within the micelle. Let's look at some examples of how solubilization is used. Griselfulvin, which is an antibiotic, is formulated with cetomacrolol, which is a surfactant. Cresol and chloroxylenol, which are antiseptics, can be solubilized by adding soap. By the way, chloroxylenol is the active ingredient of Dettol. Fat-soluble vitamins, which is vitamins A, D, E, and K, can be solubilized with polysorbates. The fourth method of improving aqueous solubility is through complexation. A poorly soluble drug can bind to a soluble material to form a soluble intermolecular complex. For example, cyclodextrin is often used to improve the solubility of drugs. Cyclodextrin, which is the molecule drawn in green, has a donut shape. The inner cavity is hydrophobic here, which also means water-hating, and the outer surface is hydrophilic, which means water-loving. By allowing a hydrophobic drug, which is water-hating drug, to sit in its cavity, cyclodextrin can help to improve the solubility of the drug. Of course, it is also important to ensure that the complex is easily reversible. If the binding of cyclodextrin to the drug is irreversible, then the drug cannot be released to be absorbed by the body. The fifth approach to improve aqueous solubility is to control the particle size of the drug. The smaller the particle, the better its solubility will be. However, this is more important when making suspensions rather than solutions. Finally, the last approach to improve aqueous solubility is to chemically modify the drug. Drugs that are poorly water soluble can be converted to their salt forms, which would be more water soluble. For example, hydrocortisone, prednisolone, and betamethasone can be produced in the form of their sodium phosphate salts. However, the modified salts will be considered as a new chemical entity, and a full toxicity, pharmacology, and pre-formulation studies will need to be carried out before it can be approved for sale. In some cases, solutions are formulated in a different solvent other than water. This is necessary when a drug just cannot be dissolved in aqueous systems, the drug is chemically unstable in aqueous systems, or the drug is intentionally formulated as a depot therapy where an oily solution is injected into the muscle and the drug will be released slowly from the site. When choosing the solvent, we need to consider whether the solvent is toxic, irritating to body tissues, has the potential to cause hypersensitivity, is flammable, cost-effective, stable, and compatible with the rest of the ingredients. The most commonly used non-aqueous solvents are vegetable oils. Some other solvents include alcohols, polyhydrate alcohols, dimethyl sulfoxide, and liquid paraffin. Now let's take a look at other additives. Besides the drug and the solvent, what else is added to a pharmaceutical solution? There are buffers, coloring agents, density modifiers, flavors and perfumes, isotonicity modifiers, preservatives, reducing agents or antioxidants, and sweetening agents. Buffers help to maintain the pH of a solution even when a small amount of acid or alkali is added to it. Buffers are usually mixtures of a weak acid and its salt. Different buffers work best at different pH, so the choice of buffer depends on the required pH and buffering capacity, which refers to the buffer's efficiency. The buffer should also be compatible with other excipients and be non-toxic. Commonly used buffers are carbonate, citrate, gluconate, lactate, phosphate, or tartrate buffers. Colors are added together with flavors to oral solutions to make a product more attractive. Colors also help with product identification or differentiation. For example, users would remember that they previously took a green or brown cough syrup. Sometimes a drug may degrade over time to form a colored product, and this can be masked by the addition of colorings. Colors can be from both natural and synthetic sources. However, synthetic dyes generally give brighter colors and are more stable than natural colors. Density modifiers are important mainly for spinal anesthetic injections, where the anesthetic must reach the proper location in the spinal cord. In the spinal cord, the fluid is known as the cerebrospinal fluid. Solutions that have a lower density than the cerebrospinal fluid will tend to rise after injection, whereas solutions that are denser than the cerebrospinal fluid will fall. To achieve precise control of the area to be anesthetized, both the density of the injections and the position of the patient on the operating table must be controlled carefully. The most commonly used density modifier is dextrose. When flavors and perfumes are added to an oral solution, the flavor should be compatible with the taste of the drug. Some tastes and their suitable masking flavors are shown here. For example, bitter drugs can be masked with flavors like anise, chocolate, mint, passion fruit, or wild cherry. Solutions for injections or for applications to sensitive areas like the eyes and nose must be made isotonic. If the solution is hypotonic, meaning less concentrated less concentrated than the solution in the cells, water will enter the cells by osmosis and cause painful swelling. If the solution is hypertonic, meaning more concentrated than the solution in the cells, then water will move out of the cells by osmosis and the cells will shrink. With isotonic solutions, the concentration of the solution is the same as the concentration in the cells. This helps to avoid pain and irritation. Preservatives are added to prevent growth of microorganisms. Preservatives should not be absorbed onto the container because this would remove them from the solution where they are supposed to be. Preservatives should not be affected adversely by pH, and preservatives should not interact with other ingredients. Here's an example of an interaction. PABA esters, a kind of preservative, are adsorbed into the micelles of certain surfactants. Since the PABA esters are trapped in the micelles, they are unable to work against microorganisms that may be present in the solution. Drugs can often be degraded by oxidation. Therefore, reducing agents or antioxidants may be added to slow down the oxidation process. Antioxidants are compounds that are easily oxidized, so they get oxidized sacrificially instead of the drug. Common antioxidants include ascorbic acid and sodium bisulfite. Sweeteners are usually added to oral solutions. Sucrose is the most widely used sweetening agent. Sometimes other sweetening agents are used, such as sorbitol for diabetics, mannitol, glycerol, hydrogenated glucose syrup, and isomalt. In some products, especially for patients who must restrict their sugar intake, artificial sweeteners such as sodium saccharin may be used. Now that we've seen what goes into solutions, let's look at the finished pharmaceutical preparations. Examples of oral aqueous solutions are syrups, elixirs which use water and alcohol as the solvent, and tinctures which also contain water and alcohol, but their active ingredients are extracts from animal or plant sources. Let's take a closer look at syrups. Syrups contain water as the solvent and typically contain large amounts of sugar or sugar substitute. Medicines and flavorings are often added to syrups. The high concentration of sugar in syrups imparts sweetness. It also inhibits the growth of bacteria due to the osmotic effect, and it increases the viscosity of the solution. In general, syrups contain sugar or sugar substitutes, preservatives such as benzoic acid, sodium benzoate, methylparaben, and propylparaben, flavorants, colorants, solvents, usually water and sometimes co-solvents, solubilizing agents which help to improve the solubility of the drug, thickeners to make the product more viscous, and stabilizers to keep the syrup in a stable single phase, for example EDTA. Take a look at this sample syrup formulation. Ferrous sulfate is the active ingredient. Can you identify the function of the rest of the excipients? Here are some other examples of pharmaceutical preparations which are aqueous solutions. Topical solutions and tinctures for application onto the skin, solutions for vaginal or rectal use, and dental solutions such as mouthwashes and gargles. Some examples of non-aqueous solutions are liniments, which are oil or alcohol-based solutions, and collodions, which are solutions of nitrocellulose in ether and alcohol. It is painted on the skin and it dries to form a film. To evaluate the physical stability of a solution, observations are made of its clarity, color, odor, taste, and viscosity. To evaluate microbial stability, microbiological testing can be performed, and to evaluate chemical stability, assays can be carried out to check for degradation of the drug. The manufacture of solutions is relatively simple. The ingredients are mixed in vessels where temperature can be controlled if a specific temperature is desired. The solution is then filtered to remove any unwanted solid particles. We've come to the end of the lecture on solutions. In this lecture, we've looked at the pharmaceutical applications of solutions, advantages and disadvantages of solutions, formulation of aqueous solutions as well as non-aqueous solutions, and additives that are used in the manufacture of solutions.